We are live. Hello, everyone. Welcome to Revolutionary Health, a program of the Counter Neonatal Project. I'm Charles Stevens, the Executive Director, and I'm joined by
David Malebranche, internal medicine physician, activist, writer,
revolutionary,
and ratchet person overall.
Okay, that's not.
Let's go.
That's Revolutionary Health After Dark.
Oh, sorry.
Hey everybody, my name is Johnnie Kornegay, Mobilization Director for the Kornegay Project, and just joining today.
Cool. And we also have our good friend Alvin, our fearless filmmaker, producer extraordinaire, helping us out in the background. Who's been working with for God forever. You knew me when I was like a baby gay. Welcome to Revolutionary Health, y'all. I'm so excited for y'all joining us. Hey, Nathan. See, Nathan joined us. We wanted to do something a little different today. We're going to actually start with sort of breaking news, right? About a Black gay man that tried to access PrEP here in the good city of Atlanta and went to a local community-based organization, which shall remain nameless. We're not saying no names right now. But he's going to tell a story and share with us his experience with trying to access PrEP in Atlanta.
Yeah.
Johnnie, what was your experience like?
Interesting. So,
hey, Mark. Also, if you have questions for Johnnie or comments, you want to share your own experiences trying to access PrEP, let us know in the comments.
Absolutely. So, interest. Okay, so first of all, I accessed PrEP in 2016. And actually had a fairly easy process. I was able to go into a facility.
Where'd you go in 2016?
I went to actually the Fulton County Health Department.
Okay, shout out to Fulton County Health
Department.
Shout out
to Fulton County Health Department. You know what? So the positive, yes, Fulton County was just amazing, right? So access PrEP in 2016 and actually expected to have an easier experience this time.
2018,
in 2018, right? So made the decision. So PrEP is one of those things, and when we talk about this a lot, but it's personal, right? It's part of our personal health. And I decided that I wanted to do it for me. Okay, again, right? So proceeded to an organization that had a PrEP clinic. And you know, the person at the front was like extremely pleasant and was like, listen, and asked the question, do you have an appointment? I said no. And they said, that's fine. Go ahead, sign in, and we'll get somebody to see you.
Yes.
So I'm like, okay, this is going to be just like last time. That was not what happened.
Like last time.
I was turned away. I mean, flat out. And
you were trying to access PrEP. You went to this place to try to get PrEP, and you were turned away.
I was turned away.
Okay.
So there were several kind of layers to the experience, right? So I get to the room, and there was a person who initially came in and was like, and they said, "Oh, what brings you in?" And I'm like, "Oh, I'm here to access PrEP." And they were like, "Well, do you have an appointment?" And I'm like, "Well, no." And I'm talking to a person, right? Do you have an appointment? No. And they were like, "Oh, okay. Well, typically we do it by appointment, so let me get somebody." And I'm like, "Well, okay, it's cool. They're just gonna do it." 2 other people come in and ask me the same question. Like, oh, what are you in for? What are you here for? And I'm like, oh, here we access PrEP. And they asked me once again, did I have an appointment? I said no. And they proceeded to, actually, it felt like an interrogation a bit. Like, we typically do this by appointment. You know, so do you have insurance? Now, fortunately, I do. So I was like, yes, I do. Do you have like financial information? Because we have to go over financial information. We have to go over your insurance. And so we typically block time. And I was like, yeah, because I know that you have to do labs. Like I've been through this before, so I get it, right? So all this to say, the person asked, so do you want to make an appointment? And I said, well, no, I don't want to make an appointment. I'm just going to go somewhere else.
Yeah.
And in that moment, I was frustrated. I recognized that I was frustrated. I also recognized that I was blessed that I could get back in the car and go somewhere else, right? So I literally sat with that and was like, well, I'm glad I can get back in the car and go somewhere else because that may not be an option for other folks.
What was your expectation about what would happen?
My expectation about what would happen would be that they would assist. Like if two people came into the room and were willing to sit down and talk to me without an appointment, so coming in, they knew I didn't have an appointment because I'm like, obviously I don't. This person's name is nowhere on my list of appointments. So if we're going to have ultimately 3 people come in and speak to me, I assumed that they would just do it.
Yes.
And not only that, we talk about, especially in Atlanta, the importance of getting folks access to PrEP, getting folks access to whatever treatment it is that they're looking for. And if I'm inside of an organization that provides service to our community, my expectation was that that's what would happen. So I get back in the car, and my friend is with me. I called you and I was like, let me tell you what happened. But I'm going to this other place and we're going to see what happened.
Right.
So go to the other place and had the complete opposite experience. I don't want to say, I'll say who it is at the end. Y'all might have a hint. Go there, stand in there. They have a new process. I stand in the line. They gave me a number. The person comes out and she's like, oh my goodness. I got the information that you're here. I know that you don't have an appointment. We have a meeting happening now, but please don't leave. Like, I want to talk to you.
Right.
And I'm sitting there like, already this person is like, oh my goodness, don't leave this office. Like, please sit here. And was really apologetic. Please sit here. I know I have to go and do this thing, but I don't want you to go. I want to talk to you. Person comes back. So I wait maybe 30 minutes patiently. I had my headphones, and works out was good. The person then takes me back, starts to go through the question and answer process, and discovered that because of the insurance, I'm quite fortunate that I have coverage now. We go through the process, and she's like, oh my goodness, I can't do this. I couldn't do PrEP through us, and I'm so sorry that I had you wait and that I had you come back here. It would be a mistake for me to try and help you because when it came time for you to fill your prescription, you'd run into a problem.
Oh, wow.
So I'm so sorry. Here's what you should do. And the person they kept apologizing. And they encouraged me. They was like, because I was with a friend, and they were like, listen, I know that your friend is here with you. I want to talk to your friend. I want you to please, while you're waiting in the lobby, while we're talking to your friend, call your doctor, call your insurance company, make your appointment. Don't stop, don't wait. You got to sit out there. They really were running down, like, you got to sit out there anyway. So do this while you wait. And that's what I did. Now, that being said, I do not have PrEP now.
You were able to get on PrEP. And it's interesting because the Project Q did a story. I think they're covering the AIDS View research about how PrEP use explodes across the United States, but Georgia still lags. So I think that's key. But you do have a question from the comments. Let's see. One question is, I'm trying to get to all the questions. Johnnie, are you in a relationship, socially, sexual? Do you bear PrEP with the PrEP?
Wow.
Or does PrEP allow you to feel free? It's just asking, like, maybe what made you, and it's a personal choice, right?
Absolutely.
But what made you decide that PrEP was the right choice for you?
Right.
Absolutely. So falling out of the regimen. So like I said, my first regimen started in 2016. So immediately in my head, I was like, oh, does it even still work? And this is actually going to be a question that I asked, to you, David. But I immediately was thinking about, oh my goodness, if I access this again, I think I remember reading somewhere that it probably won't be as effective because I was on a regimen for a period of time in 2016.
Right.
So why I decided to do it, first of all, it was important. It was important then. It was important in the in-between time. And it was really just a matter of me prioritizing it. So literally what happened was that day I had a few hours free. I was like, well, listen, I done did everything I need to do. I've been talking about PrEP.
Yes.
Let's go get it.
Let's do it.
Like literally, let's go now. So it was really just a matter of personal choice, but prioritizing what I felt like was important for me. So I would say that interestingly enough, and this is like super like personal, part of the reason why, you know, the first time of falling out of the regimen is in terms of where I was in life, it just didn't seem to make sense. Like it just didn't. And I mean, I could probably feel that way again this time, but I think what's different though is I am looking at my health differently, and the importance of that and what things for me as a Black gay man are important. And so I recognize that I'm in a different space.
And if you're on PrEP, please in the comments let us know what made you decide to get on PrEP. Was it because you were starting a new relationship? Was it because, you know, for what, I mean, there are many reasons why people might choose to want to get on PrEP. David, to kind of wrap us up, do you have just any sort of advice for Johnnie or any?
Yeah, I don't know. I think the point is an important one, that, you know, the experience that you go through, like a lot of us go through, and you can't really tell. And I mean, the funny thing is that at the end of the day, you didn't have PrEP at both institutions, at both facilities, but the experience you had at one was completely different from the other. And, you know, to me, that's kind of one of the platforms that I talk about a lot now, is that, you know, we were just talking about this. Shout out to Daniel Driffin, who just defended on his master's thesis today at Morehouse School of Medicine. Way to go, Daniel. But we were talking in his thesis defense about the difference between access to care and true access to care. And like access to care meaning that there's a building with some physicians, nurse practitioners, PAs, medical staff, where you could actually go and get care if you can make it there. And then there's true access to care, which really builds into kind of the quality of it, the quality of the interactions, how you're treated, if you're able to get some of these things done. And so it's not just enough to have a building up or to say, oh, I have a PrEP clinic, so let's go ahead and you can go to the PrEP clinic. Because if you have a provider that's not really motivated, if you have a provider or front desk staff or other staff that's like either racist or sexual prejudice or prejudice against varying gender identities, then you're going to be screwed. And so, you know, the fact of the matter is all this science, and PrEP is a great tool and a great option for like HIV prevention if you're putting that as a part of your sexual health.
Yes.
But if you have, but the problem is that you have to have a prescription.
Right.
So without the prescription, you can't get PrEP. So if the personnel that are in this site that you're trying to access are all fucked up, and just have bad attitudes and don't want to do the extra mile, like, because that would have, as you were telling the story, I was thinking that really felt me. I mean, it made me feel warm inside. That woman was like, okay, I'm gonna have you wait here. I'm gonna come back, and each time she kept to her word and came back. I had a situation long time ago when I went for HIV testing at a clinic, at a medical clinic, and I came back for a repeat test, and they told me that the results weren't back yet. And so I was freaking out because I was like, okay, the results aren't back yet, and that means I'm positive, and this is that and the other. I went in, and I remember they put me in a room, and this nurse put me in the room, and I sat there and I waited. And I waited. She's like, I'm going to get the results. I'll come right back in a second, baby. And she's gone for 10 minutes, 20 minutes, 30 minutes. And she knew I was a physician too. Like I told her I was a doctor. And this is to your point about, you know, you can have a certain amount of privilege and people will still mess with you. She knew I was a doctor. And all of a sudden it got to be like 50 minutes later, an hour later. And I'm sitting here panicking because I'm thinking, they're about to tell me that I'm positive. They're about to do this. They're about to do that. And all of a sudden, another nurse walks by and she says, oh, what? Didn't you come in here a while ago to wait on your labs? And I said, yeah, I did. I was like, it was with that other nurse, you know, the brown skin one who's kind of heavy set. She's like, oh yeah, her. She went on lunch break. And I was like, and I literally almost hit the ceiling. But then she told me, this other nurse said, well, hold on a second. Let me call the lab because there's some kind of delay. She found the report. She came back in the room and handed me the report. Or she had it in her hand. She was like, oh, well, I'm really sorry about the nurse. And I was like, the report, like, give me the report so I can know what's going on. And then fight, oh yeah, I'm sorry, you're negative, it's fine. And I was like, girl, like, what are you doing? Like, it was all that drama. And even when she was being helpful with it, it was like she forgot kind of the anxiety that you have, the stress that you have when you go in there. And it's just an interesting thing that people can just discard that this woman, knowing I was a physician, took a lunch break without following up on me. And that was the last time I was at that clinic. Like I made another appointment to see a different primary care provider. This stuff happens all the time and they don't study it because they're so busy talking about, we don't get tested. We don't get linked to care. Black gay men, you know, it's poverty, it's, you know, mental health. Now we're doing meth all the time. And so there's always some individual level pathology that's causing us not to go to spaces, but they don't want to talk about the fact when we get into spaces, that the personnel and the systems and the structures and the bureaucracy and the red tape that you have to go through makes it even more difficult for you to go through. And that's not our fault. That's not our fault. But if you had to publish that data or research that data, that would mean that the medical and public health communities would have to take a look at themselves.
Absolutely.
And nobody wants to do that because that shows that they could do better and that it's not all our fault. And when the narrative in the media has to be like, Black men loving Black men is not the Revolutionary Act, but Black men loving Black men is pathology and craziness and dysfunction. When they want to tell that story, they'll tell it to the hills. But when they want to look at themselves and look at, oh my God, our medical systems are really jacked up. Our personnel are really racist and homophobic. They don't want to tell that story because it makes them look bad.
Shout out to Walter. He has a really interesting question. Walter asks, what responsibility do you think Black men living with HIV should have in promoting PrEP?
I think Black men living with HIV
politics
are promoting a lot of PrEP. Everyone's promoting a lot of PrEP.
But do you think there's specific responsibility, or not specific, but are there, like, if so, are there responsibility, or what are some of the responsibilities?
Yeah, I think any of us,
like, let's say a Black man living with HIV wants to be sort of like a supportive of brothers using PrEP. Like, what would that look like? Do y'all have advice? Thank you, Walter.
I mean, I see it all the time in HIV prevention. So there are a lot of brothers who are living with HIV in HIV prevention, and everyone always talks about it and kind of encourages PrEP. Although, there are probably some instances where people don't do it because they're kind of concerned about treatment and access to treatment and stopping treatment, that kind of stuff. But in my experience, I've seen a lot of us. It doesn't look any different than HIV negative men promoting it. To me, at least, in my circles, what I've seen.
Shout out to Mark from London, who says, Mark Thompson, friend of ours in London. Hi, Mark.
Hey, Mark.
We're seeing similar problems and barriers with Black gay men accessing PrEP in UK, structural issues, low levels of knowledge and awareness, and not thinking it's for them. The pathology of our lives. This is a global issue. Thanks for amplifying. I mean, there absolutely should be. I think it could be an amazing opportunity to have, a diasporic conversation within the Black community about like our experiences with PrEP. I think that could be such a critical conversation. But thank you, Johnnie, for sharing your story.
No problem.
We just wanted to bring Johnnie in as a way to share his narrative. I thought it was just an opportunity to really just have a very like clear, just like someone's actual experience and not just be some sort of abstract, anecdote, which we often.
And on my way out, I do want to say, since I like to shout out the good, I talked about the first time in 2016 being Fulton County. The second time where I had the good experience again was Fulton County.
And they kind of need some good press.
Yes.
David Holland, Edith Baker, Derek Wilson, all the people at Fulton County Health Department. Way to go, y'all.
Eamon Weaver. All right. So one of the questions we got last week that we weren't able to answer on within the time frame was about good sex without anal sex, or rather about I think non-penetrative sex. So I think we're talking about we talked a little bit about like anal health in context of tops and bottoms, and I know sexual health conversations, especially involving Black gay men, typically only talk about anal sex, but we don't talk about sexual health for folks that may not be that may their sexuality may be broader than just anal sex or penetrative sex. And I was wondering if you could talk about any thoughts you had about, or suggestions, or
I mean, this is where I think personal anecdotes also help. Like I'm kind of not big on intercourse either way. People always like one of the first questions is like, are you a top or bottom or verse, or what are you? And so to me, it doesn't really always get there because I'm like, well, I'm into oral sex and foreplay, so we can do oral anal, we can do oral whatever, and as long as I'm there, like if we can get a good nut off that, I'm good. So to me, like that's a conversation. But what's interesting is that I've noticed like a geographical thing going on. And so I remember being up north, and I'm from upstate New York, lived in Philly before I lived in New Jersey. And what I noticed up there is that people were more into kind of like the intimacy part of it. So they were more into like the foreplay, you can have an orgasm, you can get a nut without actual penetration. And when I got down south, it was strange because it seemed like everybody, the end game had to be somebody getting screwed. And I didn't quite understand that. And so I think it's interesting, and I think it's a good conversation to have, because to me, there are so many other things you can do sexually to get off, and you don't have to go to penetration. I mean,
Like, what are some of the things you could do?
People use toys. I mean, people are into S&M and leather. People are into water sports and other kinds of things. And so there's a lot of stuff people can do when they talk with their partners or when they
Or cuddle.
Yeah, I kind of went right to the I went straight to like the extra stuff. But I mean, a lot of people, like, sometimes you can just, you know, lay with somebody in the bed and just kind of watch TV or just kind of sit up and just talk, and that can be as intimate and as arousing as somebody getting screwed. And so I think it always doesn't have to come down to anal sex for us, but it seems to.
What are some of your community? Like, I know a lot of. Well, I know one particular Black gay man was telling me that he was someone that sort of had a disaffinity for penetrative sex, and he was telling me that he often felt very shamed.
Right.
So that when he would wanted to have sex with somebody, when they found out that he wasn't interested in having anal sex, you know, there was like a shaming around it. So I was wondering, in your experience, what were some of the ways that you would sort of communicate? Like, what do you do with that when someone's like, you know?
Well, I mean, if somebody's shaming you for that, like, obviously it's not going to work, so dump them. So, like, leave them. Like, to me, it's just as simple as that. Like, if you're saying we can't really be intimate or have kind of any level of physical intimacy between the two of us unless I'm screwing you or you're screwing me, and that's the end game, then, you know, I'm like, bounce, because that's not going to work for me in the long run. Now you can work to some compromises and kind of work on some stuff and say, well, okay, well, why don't we could build up to this, or we could try these other things, and you never know what's going to come up with it at that point. But it doesn't need to be this kind of thing where it has to be that. And if it does come to that all the time, I would just say leave if someone's really pressuring you for that.
I mean, I think also it goes back to we don't really get good information about sexuality, right? Like, I think, you know, especially for, you know, younger brothers, I think a lot of times they get put into these categories very early on. Either you're going to be a top or a bottom. And I think, you know, sexuality is so much more than just these sort of sexual role categories, right? There's so much, so many possibilities for pleasure. And and I think that it's important to really have just better education.
And as you were saying that, I was just thinking, I have to shout out Sophia Husson, who's one of my colleagues over at Emory School of Public Health and in the infectious disease department. She actually conducted a study a few years back with a data set from men in Atlanta, all Black men of different sexualities. And she was exploring like how we learn about sex. And the three themes that came up the most, what would you think they are? She called them the three P's. So it was peers, parents, and pornography. So that's how you learn about sex. And I don't know whether that's specific to us as Black men or even more specifically as Black gay men, but it did state to me like, okay, parents may not give you all of that. They may kind of sugarcoat it or not really talk about it as much as they want to. Your peers are always gonna like be bad influences and just give you misinformation all the time. And then pornography, to be honest, a lot of it always does come down to intercourse, whether it be straight or gay. It's gonna come down to somebody being penetrated. So if these are the things that we're modeling, that's what we think is the end goal. And so I think it has profound effects because there's sometimes where I'll see guys in clinic who have problems with erections. Like they can't get it up. And they're wondering why. And then I ask them, well, do you masturbate a lot? Do you watch porn a lot? And what we found out, especially with adolescents, is that, and younger adults, is that sometimes we get these images of what we've been socialized to believe is a pleasurable experience. And when we keep masturbating and when we have our orgasms to that image, when we get in front of a real person and it doesn't meet what we think turns us on or what we've been conditioned to think turns us on, all of a sudden we can't get it up again. And then it gets deep because it's all about, like, even like people come at the same time. Like when you're screwing, the top is going to come inside you as you're coming as the bottom. That doesn't always happen. In real life, like it never happens as perfectly and cleanly as that. But we're always taught that from the visions that we see. So it's either porn where they give this kind of romanticized, idealized version,
where they're like, where they cut and you know, they edit the video.
They bring the fluffer
that
in, and the fluffer does what he needs to do, and then
the fluffer, And let us want to comment. How did you first learn about having sex? Like, and if it was in porn, like, what were some of the movies that sort of shaped?
Who were some of the stars that you remember seeing that really, that really got you going? All those kind of things. Is there much research on how porn impacts gay men's sexuality? Or I think so, and I think there is some stuff around it kind of linked with being sexually compulsive or even on the continuum towards addiction, where we use sex as kind of a coping mechanism to handle stress. And I think porn also, you think about it, but I mean, hormone wise, like, and I mean, guys, if you're out there watching, like, think about it. When you're horny, you're not really thinking clearly. Your mind's kind of all messed up. Your hormones are going crazy. And then once you have your orgasm, once you come, all of a sudden it's like, ooh, oh, wait, okay, wait. Oh, the sky is blue. Oh, wait, I got to do this work. Like, all of a sudden there's this clarity that you didn't have before. The cloud has been lifted. Yeah. And to me, that's like a physiologic thing. And I don't know whether it's been studied as intently as maybe it should. But, you know, I think we're driven by this kind of primal urge. We're driven by something that we can't really understand. And our goal is to just release. And so when we release, then we feel better. And everything is fine after that. But it's an interesting thing.
Walter said, porn is a fairy tale lullaby to a disco track.
It
I know that's right.
It really is. It really is a fairy tale.
He also
lullaby.
says, when I came out, people told me I should be a bottom because of how I looked. Little did I know. Okay, I hear that.
Yeah, I think these social impacts, like I talked about parents, peers, pornography, but I think like people tell you when they see you, they may stereotype you.
Yes.
And we could even get into kind of like the size differences in Black gay communities, like size, colorism, and the assumptions of what role you're going to assume based on your size, if you're a twink or not, if you're dark skinned, if you're light skinned.
You're anticipating the panel that we're going to do. We're actually, stay tuned for a community forum that we're going to host about colorism with the Gentleman's Foundation. But exactly, all those things we're put in these categories.
Right.
And it impacts how we see ourselves.
Right. And if we feel pressure to live up to those expectations or whether we buck against them and say, that's not what I like, like this is what I'm actually turned on by. So I think it gets kind of interesting how we're socialized as Black gay men.
Yeah, absolutely. I'm just going to look at a few more comments.
Walter.
Mark says he'll see us in Amsterdam.
Excellent. Good, Mark. We'll see you in Amsterdam in July.
You're actually, are you going to be at IAC?
Yeah, so the International AIDS Society has a conference, a global conference every 2 years. It's the biggest conference on HIV and AIDS in the world, actually. I think 20, 30,000 people usually show up, and it happens every 2 years at different international locations. And this summer in July, it's going to be in Amsterdam. And I was invited to give a plenary talk.
Hey, Ramesh.
So I'm very, very excited about doing that. I think it's July 23rd to the 27th in Amsterdam. So if any of y'all in the field didn't register, it's something to check out. It's an amazing experience. And any of you that are working with sexual health organizations, academic organizations, community-based organizations, and you have funding for travel and education, that would be a really good conference to go to.
I feel like another question that we got last week, which was around sex phobia,
right?
And it's talking about in discussion.
What do you think about that?
What do I think about sex phobia?
Yeah.
What do you think about it?
Let's talk for a little while.
Sex phobia. I mean, I think it's dangerous for us to have. I think it's really important that we have healthy attitudes about sexuality. I think any kind of I mean, I think it goes back to like the importance of just having sexual education.
Right.
That's affirming. That's affirming to our identity, first of all, and that like I think because we internalize so much stigma around the sex that we have, we have to like let it go. But then again, it's like, well, where do we go? We're really trying to unlearn sexual stigma or sex phobia. Like, how do we? There aren't many spaces where we can do that.
Yeah, and we also kind of assume that sex phobia and sex stigma actually just happens at one period of time in our maturation and then it stops. But like you'll see, like even at HIV clinics I've worked at, I've listened to providers kind of judge guys who are and women who are living with HIV and about their sexual lives. Like, well, you can't have sex without a condom anymore. You're supposed to have a condom every time, even though they fully know the data about undetectable equals untransmittable. So it's just interesting how these judgmental kind of, a lot of them are religion influenced or infused judgment decisions happen even in these provider spaces where people are supposed to be safe. And like even to Johnny's example, in a space where someone is prescribing PrEP, you can still have a really effed up experience just because someone just doesn't have the attitude or they're apathetic or they just don't feel like doing anything they want to do. And they could be gay, they could be transgender, they could be a lesbian, they could be Black, they could be Latino, and it doesn't matter because if they don't have that internal drive within them, they're like, oh, I'm tired, I don't feel like dealing. He didn't have an appointment anyway, so I'm not going to make that extra effort. And you would think these are the spaces we want to go to where we feel safe, where we feel affirmed, and it's not always the case.
Mike Ramsey says, I enjoy the conversations. I look forward to Tuesdays now. Well, thank you, Mike.
Excellent.
Yeah,
hey, Mike.
I guess finally, we've talked a lot about sort of like sexuality, particularly around, and we kind of went in a lot of different directions with that. I do have one final question that I want to ask, which is, in our community, a lot of sexual health education or information, and really sexuality in general, sort of targeting younger Black gay men. I think oftentimes like Black gay men of a certain age, hell, even over 30 probably,
right.
At this point, you're not always sort of in that narrative around sexuality.
Right.
So I guess my question is, David, what are some things that we should be thinking about in terms of like having a healthy sex life, an active sex life? Once you're over 35, over 40, like what are some things that we should be thinking about?
I do think you're right. There's a couple of things I would say is that typically, as is the case we talked about before, like a lot of times it centers around pathology. So the only time you hear particularly sexual health and HIV research talking about older Black gay men, it tends to be in the context of how older Black gay men with HIV are giving it to the younger kids. And that's all they want to say is that, watch out, younger brothers. If you guys have sex with an older brother, you're going to catch HIV because they don't care and they're more likely to have sex without condom, like all these other narratives that are pejorative, that are predominantly negative, and just kind of focus on those kind of arenas. But there's never really a sex positive message. There's one person I would shout. I'm shouting out a lot of people today. So Javante Williams, who is in Philadelphia and works at Widener University and does a lot of sexual health research over there, and looking at elders, looking at Black gay elders. And I'm 49, so I'm almost.
You're 49?
Yeah, I'm almost at that cusp.
Really?
So I'm thinking to myself, like, I'm almost at that cusp. And actually, somebody called me an elder. So I was about to say elders, they, and then I was thinking, elders, me. I think I'm part of this now. So,
people call me an elder too, and I'm like 37.
Right, exactly. So I mean, I guess it's relative. Elder to what? So with a lot of elders, there just isn't a conversation that's being had or research being done about how often we're having sex. Are we enjoying it? What are the positive aspects of how we have sex and how we sexual network? What is what goes on when we age and we have other medical conditions that could coincide? And it doesn't have to just be HIV, but as we gain weight, as we lose our energy, as we have lower testosterone, as we develop diabetes and high blood pressure and heart issues, how does our sexuality kind of morph and evolve and transition back from the days when we were in our 20s and our teens and we were really going at it, and then now all of a sudden we have to like face this new reality. It's not a thing that's just exclusive to us as Black gay men, but I think there's so many nuances to it because of issues of racism and what we experience, and because of our sexual journey with acceptance and orientation, that it just adds a little more to the conversation. But shout out to Widener and Javante doing a lot of work kind of in this area, because I think it's sorely needed.
Yeah, I've been thinking that maybe part of the proliferation of the Black bear community has, I think one of the amazing things that, Black bears have been doing is sort of countering the narrative around what can be considered desirable and what's visible, and just really, I think, showing diverse images, even sexual images. And I'm just so, grateful that, there are folks sort of in the big boy Black bear community that have just really been like, just expanding what's possible in terms of what's desirable.
Yeah, and I don't think it's about even trying to create a counter narrative. I think it's just about being yourself. And so, kids who weigh like 120 pounds or would be considered twinks or whatever, like they just are being sexual. People who are medium-sized or athletic or are gym bunnies and have muscles busting out of every orifice, like they're just having sex. And the same thing with big boys. And so, I think Big Boy Pride is coming up when? April, early to mid-April. April something in Orlando. Yeah. Who's running that still? Jay, Tony, Daniel, all those cats.
And David, could you say a little bit about Big Boy Pride?
I've only been once, and that was a long time ago. And I was thinking about going back, but I'm actually...
You should go.
I was going to go, but I'm actually going to see my parents. So family first, Charles.
All right. Well, this has been incredible. Thank you so much to our amazing panelist. Johnny, thank you for sharing your
Yay,
story.
Johnny.
David, thank you as always for your brilliance. Thank you, folks, for in the comments. Oh, Ben Robinson III says, this is a well-needed show that's full of information. All brothers need to check it out. Glad I caught it. Thank you, Ben. That means a lot.
Shout
Thank
out,
you, Alvin.
Ben.
Alvin, our amazing and fearless and resilient videographer, who accused me of being a diva, but I still love him.
Ben, an interesting note about Ben Robinson. Ben has a beautiful voice and can actually sing "Can We Talk" by Tevin Campbell, and can really knock that out the park. So,
Love it. We're so talented.
yeah, if you hook up with Ben, have him sing "Can We Talk."
Hey, Anthony. Anthony Antoine just joined.
Hey, Anthony.
Love you.
Welcome back.
But thank y'all again. We're here every Tuesday at 7. Please feel free to inbox me. Don't worry. David has enough going on, so leave David alone. But you have questions, you want us to answer, topics you want us to cover. Again, thank you so much, folks, in the comments. Love your energy in the comments. Please spread the word. Every Tuesday at 7 on our Facebook page, we'll do a Facebook Live. And just thank you for your support. Again, make sure you follow Counter Narrative on social media. We're on Twitter at Building Desire. We're on Facebook. We're also on Instagram at instagram.com/The Counter Narrative. And we're on YouTube. So definitely like and subscribe to our YouTube channel. And most importantly, join our email list. So at thecounternarrative.org, lots of plugs.
Yeah.
Are there any other things you need to plug? Any other shout outs?
I think that's it. I've shouted out enough people already.
Okay, shout out. We love your shout outs.
I know. I like giving shout outs. Recognizing good folks.
Recognizing good folks. All right, y'all. Thank you so much.
All right. See you next week.